Welcome all the subscriber of the Master Nursing classes. So here we are dealing with the integrated neurology for the NORCET. In yesterday classes, we have done with the very important topics for our NORCET examination. That is the covering layers of the brain and spinal cord. That includes our meningeal layer, okay, and the clinical correlation related to our meningeal layer. Today we are going to deal about the very important topic, that is the blood supply of the brain, and we will deal regarding the cerebellum, thalamus, hypothalamus, amygdala, okay, corpus stratum. These are very important points you have to know for your NORCET examination, okay. So I am welcoming you all to my educational YouTube channel, that is the Master Nursing classes. We are dealing here the integrated session for neurology, which includes the anatomy of the neurology, physiology of the neurology, and base for your medical surgical nursing, okay. So without delaying, we'll start our class, okay. And before going to our main class, so just see on important motivational quote that, friends, nothing is impossible in this world. Everything is possible, just we have to believe that it's possible, okay. The word impossible itself saying that I am possible, okay. I am possible. So you have to believe yourself, you have to struggle for the your success, and you have to work for your success that pays a good result for at the end of your day, okay. So it is important to that you have to believe yourself, and you have to think in that way. Nothing is impossible and everything is possible, just the way towards the looking our problems we have to change, that's it, okay. So we will move to our class. That is the blood supply of our brain. So that is studied by the scientist called Willis. So we have named this blood supply in the name of the circle of the Willis. In short form, we call this is a cow. Okay, circle of the Willis. See, here is our beautiful structure for the circle of the Willis. So you can't just practice and keep remember this one. You have to know that how the blood is coming to the brain. So it is very easy to understand. If you get understand means it is very easy to draw you, okay. So I will tell how the brain will come, blood supply will come to brain first, okay. So before seeing this one, just see, I will draw here. From back side our vertebral, okay, from back side our vertebral arteries will come, okay. See, this is our right vertebral artery, and this is our left vertebral artery. Right and left vertebral artery fuses together and it forms the basilar artery, okay. This from the this basilar artery there is an branches which supplies to the posterior part of the brain, that is the posterior cerebral artery, okay. This is our posterior cerebral artery, very important, okay. Here in the brain our internal carotid arteries get opens, okay. Our internal carotid arteries get opens, and the branch of the internal carotid arteries which comes posteriorly, that is called posterior communicating artery, okay. That is called posterior communicating artery. So both right internal carotid artery and left internal carotid artery gives one branch posteriorly, okay. So that gives the posterior cerebral posterior communicating artery. And from the internal carotid artery, for the from the internal carotid artery, so blood supply of the brain goes to the anterior part of the brain, that is called anterior cerebral artery from internal carotid artery, okay. This is our anterior cerebral artery, very important. And anterior cerebral artery, in middle of the anterior cerebral artery there is one artery goes cross line here like this. So this is our anterior communicating artery. This one is the base, but we have what is the components of the uh, our circle of pillars means we have to focus in this circle, okay. This circle, this is our circle of the pillars, okay. In the components of the circle of pillars it will come this artery which supplies the posterior part of the brain, that is called as in posterior cerebral artery, okay. And this is our main branch of the internal carotid artery. So from the internal carotid artery posteriorly which comes and joins to the posterior cerebral artery, that is called posterior communicating artery, okay. from the posterior communicating artery, from the internal carotid artery, one forward branch is there that is supplies our front part of our brain, that is the anterior cerebral artery. Okay, anterior cerebral artery, not anterior communicating artery. This one is the anterior communicating artery. Okay, this is, I will write here, anterior communicating artery. Okay, anterior communicating artery. This one. So these all are the components of the our circle of the Willis, which making one circle here. Okay, which making one circle here. This circle is called circle of the Willis. This is studied by the scientist called name Willis. Okay, so same here also. Our two main important branch vertebral arteries will come. So it goes together and makes the our basilar artery. This basilar artery supplies blood to our posterior part of the brain. Okay, so this is the posterior cerebral artery, and these all are the internal carotid artery branches 1 and 2. This branch gives one branch posteriorly, that is the posterior communicating artery. Okay, posterior communicating artery, and it gives branch one forward branch, that is the anterior, supplying the anterior part of our brain, that is the anterior cerebral artery, and in between the anterior cerebral artery, this point, that is called anterior communicating artery. Okay, here it's written anterior communicating artery. So this is the two parts we divide like circle of Willis base. This is from the vertebral artery and one from the internal carotid artery. Okay, these two creates the main blood supply for the brain. That is the circle of the Willis. I hope this I have cleared your concept. We will move in NORCET. They will ask question like this: the blood supply of the brain is called as. So simply that is the circle of the Willis. Okay, not much about this. So we'll move forward for the next topic. That is our very important part of our brain, that is the cerebellum. Okay, see, here is our beautiful structure of the brain. Okay, this is our midbrain, this is our pons, and this is our medulla oblongata. From extension of the medulla oblongata, spinal cord will go. In connection of this pons and medulla oblongata, here is the friend-like structure. Did you see this tree? This tree is called friend tree. Okay, this tree is called friend tree. It looks like a friend tree, so we call that is the, and the structure is looks like the friend like appearance. Okay, which is located behind the, this is our pons, and this is our medulla oblongata, this is our midbrain. Okay, it's located behind the pons and medulla oblongata mainly. Okay, and this is called, also called as the little brain of our body. Okay, why? Because it's structurally very much small, but half of the neuron that is present in the brain is present in the cerebellum. Okay, as compared to the cerebrum and cerebellum, so the cerebrum is the largest part of our brain. Okay, this is the largest part of our brain, but this cerebellum containing the 50 percentage means 50 percentage means half of the neurons also present in the our cerebellum. Okay, next we will move forward for the structure of the cerebellum. Like this, it looks like this. I have told this. This is our very important midbrain. This is our pons. Okay, this is the pons, and this is the medulla oblongata. Okay, so here is the connection between the cerebellum and these three parts. So the peduncle means the connection between the midbrain and the cerebellum is the superior cerebellar peduncle. Okay, superior. This is the superior cerebellar peduncle. Okay, and the connection between the pons and the cerebellum is the midlone. Okay, that is called mid cerebellar peduncle. Peduncle means simply it's some connection. Okay, so it's in pathway, it's in connection, and the connection between the medulla oblongata and the our cerebellum is the, that is the last one, inferior cerebellar peduncle. Okay, inferior cerebellar peduncle. These three fiber-like structures which holds the cerebellum in contact with the brain structure. Okay, in contact with the brain structure. First one is the superior one, mid one, and Last one is the inferior one. Okay. So this is how our brain holds the cerebellum. Okay. Next we will move for the important points, that is the function of the cerebellum. Cerebellum is very much important for maintaining the posture of the body, okay, and equilibrium of the body and or movement of the body. Okay, very important question comes in your any nursing competitive exam, that is posture, equilibrium and movement is maintained by our cerebellum. Okay, all if it is bodies are maintaining all these means our body is coordinating normally, means the coordination and balance is maintained by our cerebellum. Very important point. So in case of damage to the cerebellum, loss of the coordination and balance. So loss of the coordination and balance means loss of the gait. Okay, loss of the gait we call the ataxia. Very important word for your NORCET examination, that is the ataxia. What is ataxia? Ataxia is the loss of the coordination and balance, that is called the ataxia. Okay, very important. So cerebellum is responsible for the maintaining the posture of our body, okay, and equilibrium and movement. Next, and cerebellum is very much important to maintain our proprioception of the body. What is the proprioception? Proprioception is simply sense of the position. Okay, so my cerebellum is normal, so I know that I am in the sitting position. Okay, and if I am sleeping means I know that I am in the sleeping position. So what is the position of our body means I am having the sense that what position I am in. Okay, so that is the proprioception. That I don't know whether I am standing, whether I am sitting, whether I am sleeping means, if I don't know, that means my proprioception is not normal, means my cerebellum is not working normally. Okay, cerebellum is responsible for the maintaining the proprioception of the body, that is the sense of our position. Sense of our position is simply that we are knowing ourselves that in what position we are. So that is called proprioception. Okay, in case to check the proprioception, we will do one very important clinical test, that is the Romberg test or Romberg sign. Okay, and in this test, examiner wants to ask that what is the nursing responsibilities while doing the Romberg test. Okay, for what purpose we are doing the Romberg test? To assess the body is in proper proprioception or not. So, and body is in maintaining the proper gait balance or not. At that point of the time, we are doing the Romberg test. If the cerebellum is not working properly, body is not coordinating properly, means while doing this Romberg test, patient having the highest risk of the falling. Okay, so first I will say what is the Romberg test or what is the Romberg sign. Then I will come for the nursing responsibilities while doing the Romberg test or Romberg sign. Okay, see this person. Okay, this person is standing with open eye and he is maintaining his proper balance. Okay, if the examiner is behind the patient, okay, or else the weak side of the patient, and we are asking the patient to close his eyes. Okay, after standing in erect anatomical position, we are asking the patient to close his eyes. After closing his eyes, if the patient is maintaining proper balance, means his cerebellum is working normally. Okay, if the patient is not maintaining his proprioception or his balance, means, so that is called as the Romberg sign or Romberg test. Okay, so while doing this Romberg test, there is a highest risk of the fall risk injury. Okay, fall risk injury means the person may fall down and he will get injured. So nursing responsibility while doing the Romberg test goes priority as an patient safety. Okay, patient safety. How you will take care of the patient means, if the patient will comes with the complaints of right side weakness, left side weakness, means we will stand the weak side. Okay, but still undifferentiated weakness is there, means we will stand behind the patient, that by elongating our hands either side of the patient. Okay, either side of the patient, because patient may fall this side also, may fall this side also. In order to hold the patient, we will stand behind the patient and we will extend our arms both side of the patient. Okay, so and we will do the test. This is one important point. Where we will stand? We will stand the weak side of the patient, otherwise the back side of the patient. Okay. So and another one important point is we have to remove all the articles. Those may be sharp articles or those may be unwanted articles that is uh, near to the patient. Okay. See, this is the table having the sharp edges. If the patient falls here, means he may get the deep injuries. So our responsibility is to remove this object from the testing environment, that if in case patient falls accidentally also, he will not get that much of the serious injury. Okay, this is the two nursing responsibility, very important. We will stand the weak side of the patient, and if the patient is undifferentiated weakness, means we will stand the behind of the patient, and secondly we will remove the unwanted articles from the surroundings, that helps for the preventing the injury for the patient. Okay, so this is the two important things while doing the Romberg test or Rombergson. Okay, and in order to assess the cerebellar function, and clinically healthcare provider also do one bedside test, that is the nose to finger test. Okay, so consider this is the healthcare provider's hand. Consider I am as a patient. So just holds the healthcare provider holds his finger like this and asks the patient to touch his nose and touch his finger. Okay, this is called finger nose test. What is this called? Finger nose test. We'll do this finger nose test in order to assess the function of our cerebellum, means the function of the coordination of our body. Okay, this is called the finger nose test. Okay, the examiner or the healthcare provider may vary the position of the finger like this. Okay, ask the patient to touch the finger and touch back his nose. Okay, touch the finger and touch back his nose. This is called finger nose test. Okay, very important. Two tests we will do for the assessing the cerebellar function, that is the Romberg test or Rombergson, and the finger nose test, very important for your NORCET examination. Okay, next, we will move for the next slide. That's the clinical correlation of the cerebellum. Okay, very important. Cerebellum. If there is a loss of balance and gait, means that is called cerebellum. Okay, so like if an alcohol patient is walking in road, means he will walk like this side, and he will fall forward. He will fall backward also. So this is called loss of the gait. Means loss of the control while walking. That is called loss of the gait. So in case of the loss of the balance and gait, means the very important word the examiner may ask in your exam is the ataxia. What is ataxia? Ataxia is the loss of the balance and gait. Okay, and very importantly, our cerebellum is responsible for maintaining the tone of the muscle. Okay, tone of the muscle. So I am contracting my muscle. Okay, I am extending my muscle. I am having the normal tone of my muscle. I can resist against the force. I can hold the force also. So my muscle is coordinating with normal tone. So that is called tone of the muscle. Okay. If my muscle is contracting very tightly, means my tone of the muscle is increased. So that is called increased tone is hypertoning. Okay, hypertone. So my muscle of the body muscles are not responding to the resistance, means not holding the resistance. They have not having the much power to uh, even not having the much power to rise against the gravity also. So that is called loss of the tone. That is the hypotonia. Okay. So increased tone of the muscle is called hypertonia, and decreased tone of the muscle is called hypotonia. Okay. So this is the very two important words. What is the hypertonia? Hypertonia means increased muscle tone. That is called spasticity also. Spasticity. Okay. And this occurs in the disease of Parkinsonism. Okay. Parkinson's disease, the spasticity of the uh, muscles occur. So we will find the sign symptoms like the rigidity. Okay. Stiffness of the body, we'll see. Okay. Spasticity simply indicate the uh, stiffness of the muscles, we will see here. Okay. Okay, rigidity, stiffness of the muscles, we will see here. I think this point is not visible for you because my photo is coming here. So I'm erasing this one. Okay. So spasticity simply indicates the increased tone. Okay. There is no tone in the muscle means that indicates the hypotonia or flaccidity. Okay. Flaccidity. See, this is what flaccidity means, the loose muscle. Okay. The tight muscle is called spasticity. The loose muscle is called flaccidity. Okay. Very important to understand. Okay. Next, we will move for the next part of our brain, that is the thalamus. So we are moving ahead for with thalamus here. Very important. See, if any information coming from periphery to the central nervous system means it will come by thalamus. Okay, it will come by thalamus and it will process with the thalamus and it processes in the thalamus. So thalamus is the important point, works as a sensory relay station. Okay, any sensation which are coming from the periphery to the central nervous system, periphery to the central nervous system means it should it will go across the thalamus. So thalamus processes the sensation and it sends the sensation where it is necessary, part of our brain. Okay, except smell or except the olfactory, all sensation, touch sensation, okay, our body position sensation, so smell sensation or temperature sensation, everything it will go through the thalamus except one, that is the smell. So it may ask in your examination, but in updated books they are mentioned that smell is also regulated by the smell sensation, also regulated by the thalamus, but in our few competitive books it's mentioned as an except smell. So here is the some debate is there. So if it is any clear update will come on these points means I will update in next classes. Okay, so in case of any hamper in the process of the or the function of the thalamus, so there is an loss of the sensation, that is called the paresthesia. Okay, what is the important function of the thalamus? That is the sensory relay station. In case any damage to the thalamus, there is no regulation of the sensory functions, so it may leads to the loss of the sensory functions, that is called the paresthesia. Very important point. Next we will move ahead for our hypothalamus, the structure that is below the thalamus, that is called the hypothalamus. Okay, very important. The structure that is below the thalamus, that is called as the hypothalamus. Hypo means below, thalamus means thalamus, just we have studied. So below that structure this hypothalamus is present. So that is the point I mentioned here, present below the thalamus. And at what position it exactly below the thalamus means, see, this is the thalamus, consider this is the thalamus. Okay, and this is the hypothalamus. Okay, this one is the hypothalamus. Hypothalamus present inferior means down and anterior. This is the posterior, this is the anterior. Okay, this is the superior, this is the inferior. Where exactly hypothalamus is locating below the thalamus, that is, it is anterior to the thalamus. Okay, and inferior to the thalamus. That is very important point. Examiner will ask in this one, inferior and anterior to the thalamus. Okay, when it comes for the functions and physiology of the hypothalamus is very very important. That, so I don't know how many times examiner asks question in these points means temperature is regulated by, temperature is regulated by, temperature is regulated by hypothalamus, hypothalamus, hypothalamus. Okay, this is the one liner that is asked in many exams repetitively. Okay, so keep in your mind and note it with highlight, that is the temperature is regulated by hypothalamus of the brain. Okay, and hunger and satiety value of our body. Okay, hunger is the craving for the food and satiety value is the fullness after having the adequate amount of the food. So both are regulated by our hypothalamus, and hypothalamus is having the endocrine function that is very important, that regulates the sleep awake cycle, that regulates the reproduction functions, that regulates the many water balance, acid balance, everything. Okay, we will discuss that hormones, what are the hormones which are regulating. So I think you know endocrine function means, endocrine function is that any gland, okay, without a duct which is secreting the hormone, so that is called as the endocrine gland, or any gland which is secreting the hormone inside the duct or inside the pipe-like structure, so that is called exocrine glands. Okay, so I think hypothalamus don't have any exocrine functions. It is having the very important the endocrine functions, that it releases the hormones. Okay, so the hormones which is released by the hypothalamus are growth hormone, releasing hormone, very important. First hormone is the growth hormone, releasing hormone, and second one is the growth hormone, inhibitory hormone. Third one is the prolactin releasing hormone. Okay, fourth one is the prolactin inhibitory hormone. Okay, and fifth one is the thyroid releasing hormone. Sixth one is the corticotropin releasing hormone. Seventh one is gonadotropin releasing hormone. Eighth one is the gonadotropin. Sorry, it's double. Okay, only seven hormones are there. It's got double here. Only seven hormones. Okay. So growth hormone releasing hormone which releases from the somatotrope cells. Okay, the cells which are responsible for the releasing the growth hormone are the somatotrope cells, and which is responsible for the growth. Okay, stimulates the growth. So because of this growth hormone is also called as an growth hormone releasing hormone is also called as an somatotropin. Okay, what we call that is somatotropin. Somatotropin. Okay, and growth hormone inhibitory hormone that acts on the pituitary gland and it inhibits the function of the growth hormone, and it decreases the amount of the growth hormone in body, so it holds the growth function, that is called, it inhibits the growth function. Growth hormone inhibitory hormone inhibits the growth function. This uh, 1 minute, I will change the color of the pen, it's not unable to see here. 1 minute. Okay, so growth hormone, inhibitory hormone, which releases from the hypothalamus, it acts on the thalamus. Okay, it acts on the thalamus, and which really decreases the amount of the growth hormone here. Okay, so it which inhibits the amount of the growth hormone. Okay, if growth hormone is decreasing means growth also decreasing, so because of that growth hormone inhibitory hormone is also called as an somatostatin. Okay, somatostatin, statin means it's stopping, static, static means stop the growth is called static. Okay, so next hormone comes our prolactin releasing hormone. So prolactin releasing hormone which acts on the anterior pituitary from the lactophore cells, it releases and it acts on the anterior pituitary, and from anterior pituitary prolactin will release. Okay, so this prolactin is responsible for the production of the milk. Okay, that is production of the breast milk. Okay, that is called as stimulus the lactation. Lactation means 1 minute, please. Okay, lactation means production of the milk, that is called the lactophoresis. Okay, so done by the prolactin hormone. And one more hormone that is releasing from the secreting from the hypothalamus and storing in the posterior pituitary, and which releasing and which responsible for the ejection of the milk out, that is called oxytocin. That hormone we call the lactokinetic hormone. Okay, so only that is responsible for the movement of the milk, not to produce of the milk. So its production means it's called lactophoresis. That is the hormone responsible for the lactophoresis is the prolactin. We will study this one in next classes in detail in endocrinology. Okay, don't worry about this. So just I am creating the base here. Okay. Next hormone comes the prolactin inhibitory hormone. So that is inhibits the formation of the prolactin. So it inhibits the lactation. Okay, it inhibits the lactation. So next hormone, thyroid releasing hormone, which acts on the anterior pituitary. From anterior pituitary, thyroid stimulating hormone will release. That thyroid stimulating hormone will go and act on the thyroid gland. Thyroid gland releases the T3 and T4 hormones. So those are called thyroid hormones. Okay. Next, it releases the corticotropic releasing hormone. Corticotropic releasing hormone, which acts on the adrenal cortex. Okay, because only it acts on the adrenal cortex, not on the adrenal medulla. Because adrenal medulla is regulated by the autonomic nervous system. From there, from adrenal medulla, our neurotransmitters are releasing like dopamine, adrenaline, noradrenaline, so also called epinephrine, norepinephrine, that is regulated with the autonomic nervous system. Corticotropic releasing hormone only acts on the cortex part of the our adrenal gland. Okay, so corticotropic releasing hormone releases from the hypothalamus, which acts on the anteropituitary. From the anteropituitary, adrenocorticotropic hormone will release ACTH. That ACTH acts on the adrenal gland. So adrenal gland releases the adrenaline hormone. That's the aldosterone. Okay, salt, sex, sugar hormones, glucocorticoid. That one that will release. Okay. So next we will move for the uh, gonadotropin releasing hormone. So which is responsible for the this gonadotropin releasing hormone acts on the enteropituitary. So this from the enteropituitary, gonadotropin releasing hormone acts on the enteropituitary. From the enteropituitary, it acts on the ovaries, on the gonads. So gonads will release the gonad. This is what we call the sperms and ova will regulates by this. Okay, so gonadotropin hormones like FSH and LH regulated by the gonadotropin releasing hormone. Okay, so these are the 7 hormones. Among these 7 hormones, there are four release. Okay, this is 1, 2, 3, 4, 5. 5 releasing hormones and 2 inhibitory hormone. Okay, 5 releasing hormone, 2 inhibitory hormone, total 7 hormones which are released from the hypothalamus. Inhibitory hormone and releasing hormones are released from the hypothalamus. Regulatory hormones will release from the anteropituitary. Okay, so just I will describe the relationship between the anteropituitary and thalamus and pituitary gland. Okay, it is very important to know that. See, this is our beautiful structure of the hypothalamus. So in between the hypothalamus and anteropituitary, here it is the direct connection. It in glandular relation. Okay, it's a relation like a glands. Okay, from the hypothalamus, these are releasing hormones. Like I will take one example: thyroid releasing hormone. Okay, TRH is released from the thyroid hormone. Thyroid hormone releasing hormone is released from the hypothalamus. From it acts on the this anteropituitary. This anteropituitary releases the like thyroid stimulating hormone. This thyroid stimulating hormone acts on the our very nice thyroid glands. Okay, so our thyroid glands. So this our thyroid gland releases the T3, T4. This is how the relationship between these glands. Okay, so the relationship between the hypothalamus and anteropituitary is called adenohypophysis because it only regulating like glands. From here, hormones are releasing, it coming and acting here. So it's like glandular stimuli. Okay, so we call this is an adenohypophysis. Adeno means the gland relationship. Okay, so adenoma means the tumor of the some glands. Okay, like this it will come. And in posterior pituitary, so hormone are producing in the hypothalamus only, and which is coming and storing in the posterior pituitary. So whenever there is a necessary posterior pituitary releasing these hormones, so means the hormones are produced in hypothalamus. That is the neural part. So it is called the neurohypophysis. Hypophysis is the another name of the pituitary gland. Okay, hypophysectomy is the removing of the pituitary gland. Hypophysis is the or pituitary gland name. Okay, so the hormones are producing inside the hypothalamus and it is coming and storing in the posterior pituitary, which is released by the posterior pituitary whenever necessary. So that is called as the relationship between the hypothalamus and posterior pituitary is the neurohypophysis. Very very important questions. And the relationship between the hypothalamus and anterior pituitary is the adenohypophysis. Very important. Okay. Our next topic comes to the basal ganglia. Before going to the main topic of the ganglia, I want to clarify your base here. What is the ganglia and what is the nuclei? Okay, what is the ganglia? What is the nuclei? Okay, very important. See, the group of the nerve cell body or the group of the gray matter inside the brain is called the ganglia. Okay, inside the brain and spinal cord. Means inside the uh, central nervous system. Those are called the ganglia. See, this is the nerve cell body, nerve cell body, nerve cell body is forming the gray matter. Okay, is forming the gray color matter because of the nasal granules. Okay, this is our group of the axons forms the white matter. So here is the group of the nerve cell body or the group of the gray matter we call as an inside the central nervous system. Group of the nerve cell body is called nuclei. Okay, nuclei, and it may same in the spinal cord also like this. So group of the nerve cell body inside the spinal cord also called the nuclei. Okay, but the group of the nerve cell body outside the central nervous system means outside the brain and spinal cord is called ganglia. Very important point. Ha, sir. This is the base we have cleared here, but we have raised one doubt here. So one part is there in brain that is we call the basal ganglia. Why, sir, we call this is the ganglia? Because it is inside the brain means inside the CNS. We can call this is the basal nuclei. Why we are calling this is basal ganglia means it is actually a basal nuclei only. It's in like in medical we say this is the professor made mistakes. Okay, so since from the many years many books are printed like it's ganglia, it's a misnomer. Actually it's a misnomer. We call this basal nuclei only. In updated anatomy books it came as a basal nuclei only, not a basal ganglia. So you just uh, know you have to know that one basic point. That's the group of the nerve cell body inside the central nervous system is called nuclei. Group of the nerve cell body outside the central nervous system is called ganglia. Okay, very important points. Okay, next we will move for the parts of the basal ganglia that is very much important. So first part of the basal ganglia comes to our amygdala. Amygdala is responsible for the fear regulation. Please note, examiner may ask the direct question from here, and it regulates the food and sexual arousal regulation. Okay, food and sexual arousal regulation. And second part of our basal ganglia comes to the corpus stratum. Okay, corpus stratum. Corpus stratum is which produces the support system of the pyramidal tract that is present in the premotor area, and that forms the extra pyramidal system. Okay, so damage to the corpus stratum may produces the extra pyramidal symptoms. Okay, we'll study this one in the psychopharmacology while studying the typical antipsychotics. Okay. Next part of our basal ganglia, third part of our basal ganglia, that is the substantia nigra. Substantia nigra that produces the dopamine, very important. So very important point for your NORCET examination. Dopamine is produced from the substantia nigra and CSF is produced from the choroid plexus. Very good. Okay. So in case of any damage to the substantia nigra means there is decrease in the production of the dopamine. It decreased dopamine means dopamine get decreased means dopamine is the inhibitory neurotransmitter hormone, neurotransmitter. Okay, in case it is get decreased means there is no inhibition in the on the skeletal muscles. Okay, skeletal muscles start involuntarily moving. So voluntary movement of involuntary movement of the voluntary muscles is called tremors. Okay, it produces the tremors and muscles become rigid, stiff. Okay, muscles become rigid. So facial muscles become weak and it will get droops down and there is no expression from the face. That is called mask-like face. Mask-like face, where we will see all these symptoms: rigidity, pin rolling tremors, mask-like face. We will see this in the Parkinson's disease. Okay, we will see this is in the Parkinson's disease. Very important. We will move forward to our next topic, that is nigrostriatal pathway. Okay, it is very important. I have told here related to the stratum, corpus stratum, which forms the which supports the pyramidal system, that is the motor system, that is called extrapyramidal system, and substantia nigra produces the dopamine. Some nerve fibers are there which regulates the dopamine. That is the connection between the corpus striatum and the substantia nigra. That is called the nigrostriatal pathway. Okay, that is called the nigrostriatal pathway from the substantia nigra. Okay, from the substantia nigra and the from the corpus striatum. So the fibers will comes together and which makes the nigrostriatal fiber pathway. In case of any damage to the this nigrostriatal pathway means, so there is an imbalance in the dopamine balance. This is responsible for maintaining the dopamine balance. Okay. So in case of damage to the any nigrostriatal pathway means, so there is an imbalance in the formation of the dopamine. Okay. And there is this nigrostriatal pathway is also called as a dopaminergic pathway. Okay. So if it get damaged means the nigrostriatal pathway get damaged means it produces the Parkinson's disease, where we will see the tremors, rigidity, mask-like face. Okay, so we'll study this disease condition separately because very important disease condition for your exam purpose. Okay, so this is what about the basic you need to know before studying the Parkinson's disease. Okay, here it comes to the uh, substance in nigra, and this our very important topic, basal ganglious functions. Okay, next we will move forward to the spinal cord, very important. So spinal cord is the structure which start extension from the medulla oblongata, which I will draw on basic structure here. This is our beautiful brain. Okay, this is our midbrain, pons, medulla oblongata. Okay, this is the medulla oblongata, and here it comes our cerebellum. We have studied recently only. So from the medulla oblongata, spinal cord extends down. Okay, spinal cord extends down like this. Okay, what is this one? This is our foramen of the magnum. This is our skull bone. See, this is our beautiful nose, mouth, and here it comes our skull bone. This bones where there is one opening, from there the our spinal cord is running downward. Okay, so that opening we call as the foramen of magnum. Okay, that opening we call foramen of the magnum. Very very important point. From where spinal cord start? That start from the foramen of the magnum. From where the spinal cord will end? It ends at the lumbar 1 vertebrae. Okay, lumbar 1 vertebrae. Okay, from where the spinal cord is get extended? It's an extended part from the medulla oblongata. Okay, spinal cord is an extended part of the medulla oblongata. See, it's extended from here. Okay, it's not extended directly from the brain. It's extended from the part of the brain that is the medulla oblongata. Okay, very important. Three questions here. 1 minute, friends. So we will discuss this class in next session because my laptop battery is low. So we will discuss in the next session. So thanks for watching the video until this one. So spinal cord, we are ending our class to after the spinal cord. So thanks for watching my video. If the information found in helpful for you, please do subscribe my channel and share this video with your friends. Thank you.